Hello, I'm Gerard Cush. I'm a foot and ankle orthopedist working at Evangelical Community Hospital. So surgery days here for total ankle replacement. At this point in time, you've already gotten your x-rays, your CAT scan, your patient-specific instrumentation has already been designed, ordered, and is in-house. You're going to show up at the main hospital here at Evangelical's campus. So once they intake you into the preoperative process, they'll make sure that you haven't eaten after midnight. They'll get your IV in place. And very often we do total ankle replacement under a peripheral nerve block. A peripheral nerve block is where the anesthesiologist will actually numb up the limb above the level of where we're going to be doing the replacement. This is a great way to get your surgery done. Number one, it allows for good anesthetic during the procedure, minimizes the need for general anesthesia, and post-operatively you'll have pain relief from the actual block. Once that block is in, we'll take you back to the operating room. You'll meet the team, which will consist of a scrub tech that helps us in the operating room, my team with my PA, in addition to the CRNA, who's the one that will also manage your anesthesia. And then there's also a circulating nurse that will allow us to get the parts that we need in order to do the procedure. Majority of the time, total ankle replacement takes around 90 minutes of surgery. After the procedure, you'll go to the recovery room and you're in a big bulky splint. This is for soft tissue protection. You're non-weight bearing, which means not walking on it. So we'll either use crutches, a walker, or one of those knee wheelies in order for you to get around. The first 10 days to 2 weeks is really important for keeping it up and elevated. Soft tissue swelling with any lower extremity type of surgery is really important to manage. This will help decrease the chances of wound complications and infection and give you a better chance of having a very good result. After about 2 weeks of splinting with non-weight bearing and toes to the nose elevation, we then bring you back and we'll get your sutures out. And most of the time we're able to get you to a boot, a cam walker boot, which you can take on and off the wash and shower and start range of motion. I usually start full weight bearing around the 6-week mark, but in between the 2-week mark and the 6-week mark, we're able to put the foot down for just some balance and stabilization, and then work with therapy to gradually get you moving and walking on it. Most patients are full weight bearing by the time they get to the 8-week mark, and then by 3 months, we're well on our way to good recovery.